So in my other video, we talked about the Piccolo, which is a blood analyzer. Obviously, in order to analyze the blood, you have to get the blood. And so that was one of the things that I had to learn. If you notice, I look like a low-key heroin addict with bruising and everything. And that's, I guess, the natural result of stabbing yourself 8 times in each arm to retrieve blood. But this is what I put together. It's a blood lab in a bag. And this is what I will... this is what I use to draw blood when I have to for various research purposes. So it's got kind of 2 main pockets here. This is actually like a $10 Amazon bag. It's red because of blood, obviously. So we have a couple different bits and bobs here. These are tube covers. I'll kind of go over what all these are. All right, so this is kind of what we got from our portable blood lab. So basically, in the front pocket, I keep, this is a Keto Mojo, very standard couple of markers, and these are the test strips that run the CardioChek. So the CardioChek is this portable lipid panel in the box. It's got a reflective reading on the back there that enables it to determine the relative concentrations based upon some really cool, nifty chemistry things of like HDL, triglycerides, and total cholesterol, and calculate LDL. So we've got tube covers. These are BD 23 gauge needles. These are the blue ones. They're a little bit smaller than the 21 gauge ones, which a lot of phlebotomists use, but I guess they hurt a little less. Honestly, they're pretty nifty. So they've got a cover that comes on them there, so to prevent you from accidentally stabbing yourself. And this actually, when you're done, you can slide this over and it'll cover the needle, so there's no risk of any accidental additional stickings. And the tube cover slides around that there. And so this is a little fill-a-madoodle. I don't really know the technical term for it, but basically this is a vacuum tube. So there are a couple of different ones we have here. These are empty tubes. They're just discard tubes. So there's a little bit of air in the line here when you insert the tube. So once you get it into the vein, you'll basically want to pull that out. If you don't pull the air out, so these are vacuum tubes, so they have a particular amount of air removed to determine the amount of volume that they'll fill. And if you don't do that, you'll end up with a slightly different ratio of EDTA, so this is anticoagulant in here called EDTA. And if you don't pull the air out, you'll get a slightly different ratio of EDTA, which can affect some tests. I'm sure it's probably not the biggest deal in the world, but it's something to note that can affect the reliability of your results. So that's why you use a discard tube. These are, over here are lithium heparin tubes. So this is a note card box with a tube holder bottom in it. But so these are lithium heparin tubes, 2 milliliter tubes. And we use these for the Piccolo over there to run the assays there. Dog is saying hi. These are coagulant tubes. So this on the left here is just a standard serum tube. So you basically fill it up, it'll clot, and then you can spin it in a centrifuge, and it'll all separate, and you'll end up with a serum on top. You saw that in our Game Changers experiment video. And then this one's a gel separator tube, so it draws a little bit less blood, and that gel will end up in between each of the components of the blood there. So yeah, and then these are tourniquets, obviously. These are disposable, although I don't really dispose them. You gotta have gloves, of course, to make sure you're precautioned. Little alcohol swabs, definitely not sterile paper towel. Micropipette tips, these are to pipette the amount of sample. This is a 10 to 100, so the CardioChek requires 40, and the Piccolo requires 100 milliliters of sample that you have to pipette out. And yeah, that's basically the tour. I've also been experimenting with mail merge to print labels for these tubes so that they'll look all very professional. But so that's basically the blood lab. It packs up in there, and then we can bring that around to draw blood from people, and it's very, very exciting.